Homelessness is a growing crisis in Santa Cruz, California. Despite substantial government funding aimed at alleviating this issue, many question the effectiveness and fairness of these efforts. The central question is not only about the amount of money allocated, but also about who benefits from these resources, and more critically, who does not. So let's jump right in. Santa Cruz has seen significant investments in addressing homelessness, including grants for shelters, mental health services, and affordable housing initiatives. Encouragingly, the homeless population in Santa Cruz has decreased by 36% over the last year, attributed to outreach programs and affordable housing initiatives. However, the 2022 report by John Connery identifies that there's still another 2,300 homeless people, and which is a 6% increase from 2019, with 77% living unsheltered, as seen by the data table. One of the most pressing issues with homelessness is its disproportionate impact on marginalized communities in Santa Cruz. Indigenous, Black, and Latinx people are overrepresented among the homeless population. These communities face systemic barriers, including discrimination, lack of affordable housing, which increases their vulnerability to homelessness. A critical issue is that large portions of government funding are absorbed by administrative costs and temporary solutions, often failing to reach the most vulnerable people. Programs impose restrictive requirements like sobriety conditions or lengthy application processes, which excludes individuals struggling with addiction or lacking documentation. Consequently, those closer to stability benefit disproportionately, leaving the marginalized behind. Further complicating the issue is regional disparity. While Santa Cruz's homeless population decreased by 36%, Watsonville saw a 60% increase, as reported by Tinia Orts. Limited resources and shelter space in Watsonville highlight the critical need for equitable funding distribution across the county. Efforts like Watsonville's $500,000 towards homelessness prevention program are steps forward, but remain insufficient for addressing mental health and substance abuse support gaps. Programs often lack input from the homeless community, resulting in solutions that fail to address lived realities. For example, while policymakers may prioritize shelters, unhoused individuals frequently express a preference for permanent housing that provides stability and dignity. Additionally, funds that are sometimes diverted to policing and cleanup efforts that displace individuals without offering viable alternatives, perpetuating cycles of instability and neglect. To address these disparities, Santa Cruz must adopt a more equitable and inclusive approach to funding. Resources should prioritize low barrier shelters, harm reduction programs, and permanent supportive housing. Including the homeless in policymaking can ensure that we align with their needs. Merenstein's All-In Plan emphasizes collaboration with community organizations to end homelessness altogether. Finally, the city must shift its focus from managing homelessness to ending it, addressing systemic factors like income inequality and inadequate mental health services. While Santa Cruz dedicates significant funding to combating homelessness, much of this money fails to reach those who need it the most. Administrative inefficiencies, restrictive program requirements, and inequitable resource distribution hinder progress. By rethinking priorities and centering the voices of the homeless, Santa Cruz can transform its funding strategies into a force for social justice, ensuring that no one is left behind.